coming to our lunch and learn today. We love having lunch and learns now that COVID's over. We can reconvene, and so we're so happy to see everybody here today. This is Dr. Bastian. Dr. Bastian is our very first plastic and reconstructive surgeon at Colquitt Regional, and we are so happy to have her on our team. She joined our team around in the fall of 21, so she's been here just a little while, but we are so happy to have you here, and we're happy to hear about what you're going to talk about today. So, Dr. Bastian.
Thank you, Jordan. Thank you. Hey, guys, I'm Tracy Bastians. I'm originally from Chicago, so to you guys, I have an accent. But you guys have an accent to me. So yes, I started here September 21, and I do a bunch of things. So I do the stuff you see on TV, like the people on Botch. Yes, I do like reconstructive stuff, but I also do a lot of cosmetic as well. Today, my prime focus, because there's a lot of misinformation going out about like post-bariatric body contouring. So I just kind of wanted to kind of start with that. Then I'll show you a few cosmetic things, and then we'll open it up, and you can ask any questions you want. No question is stupid. Please ask. Because I am new to the area, a lot of people don't know a lot about plastic surgery except what they see on TV, and a lot on TV, or if you are like Googling stuff, is actually false. So don't be afraid to ask any questions. So the field of bariatrics itself focuses and treats on those who have like obesity or overweight issues, to promote weight loss, increasing one's overall health with diet, exercise, and behavior therapy. So the field of bariatrics is not just like, okay, now you have, the gastric sleeve. We are a center of bariatric excellence here, so we're not only focusing, we do kind of try to help you lose weight even prior to having the sleeve, and sometimes you lose it so much on your own, you don't even need the sleeve. So the field of bariatrics, when someone says that, we're not saying, oh, you have to have surgery. So what I do is you come to me after your surgery and you've lost weight, or you've lost weight on your own through diet, exercise, and behavior modifications. So that's really what it is. You do have some surgical options as well if you get to that point and you want to proceed with surgery. We have the sleeve that we do here. The lap band procedure, people do it, but it's kind of falling out of favor because there are quite a bit complications to it. Something called it's a bypass surgery, and then other things that are way above this topic of conversation. But yeah, next slide. So I kind of like to go over kind of what the expectations are after you have weight loss, whether it's on your own or with the use of our Center of Excellence here in Moultrie with weight loss surgery. And so I tell people wait at least 1 year to come to me, plus 3 to 6 months of stable weight. The reason why is even insurances are not going to cover you. If you had surgery 5 months and you lost a ton of weight, or you lost a ton of weight on your own in 5 months, insurance companies still want to see that you can maintain that. So I always tell people 1 year plus 3 to 6 months of stable weight. If you get closer to 6 months, that's great. The reason why is people, a lot of times, you still lose weight for up to 18, 22 months following your weight loss journey. So I tell people, wait, don't push it, and see how much your skin can bounce back. Because a lot of times your skin can bounce back before jumping right into surgery. So usually I don't start doing surgery on people at least until 15 months, and they've shown me they've been stable for 3 months, not only for their safety, but also that we can try to have insurance help us cover these surgeries as well. And also helps you preventing me repeating your surgery, which unfortunately has happened here once. I did a abdominoplasty procedure on a patient, and then that person came back a year later. My surgery had kick-started more weight loss. He lost another 50 pounds, and he had more redundant skin again, so I had to redo my procedure, which increases his risk, or her risk, and it also causes kind of more, you can't have more wound complications because you're raising big flaps when you do surgeries. Fortunately, that person's been fine, but it can also help you save money, not repeating your surgery. I always tell people too, I do have a cutoff BMI, and what BMI is, it's body mass index. It goes off our height and our weight. And so the reason why, because to me, weight is an arbitrary number. Really, BMI tells you a little bit more about your kind of like, because someone can be really, really healthy and still have an elevated BMI because it has to do with your body composition. So weight and height come together for it. So the reason why my cutoff is 32 or below, which is still actually considered obese, is because statistics show that you have higher complications of cardiac risks in surgery, pulmonary complications, blood clots, your inability to heal from my surgery. Even if all your labs are normal, it shows that with increasing BMI, you're really unsafe for surgery, unless of course it's an emergency procedure and you have to have one, because all your risks of surgery in general go way up when your BMI is above 32. That's why that's my cutoff. Just so that way I match the literature and I make sure that surgery is safe for you. Requirements afterwards do, like I said before, the BMI is 32 or below, 1 year plus 3 to 6 months of stable weight, and also no tobacco use. I know a lot of people, that's hard for a lot of people. I know it is actually a true addiction, it's a true issue. The reason why, and I'm not gonna lecture you about tobacco use, but the reason why plastic surgeons don't want you to have any tobacco, that means nicotine patches, that means the gum, it means vaping, is because of the nicotine specifically. Yes, all the other things in tobacco are bad for you too, but it's the nicotine. Nicotine causes your vessels to shrink. So when you've already lost a lot of that weight, you have a lot of less soft tissue. Soft tissue itself has a lot of blood supply. Well, when you lose that soft tissue, your blood supply also decreases. So when you're not getting blood supply after surgery, you're not healing well. So nicotine is especially harmful on breast tissue and hands. So those are big things where I will not operate on you if you're using nicotine. And I know that sounds harsh, but it's not safe for you. Also, I do test you before surgery, and if you're positive, your surgery will be not canceled, but postponed until you can quit. I also draw some labs as well, just to make sure that I know our bariatric team here does an excellent job making sure you're getting enough protein and enough electrolytes and nutrition, but I always check these labs just to make sure that you're safe. And then also too, I encourage you to keep having the 60 grams of protein a day or more 2 weeks before surgery and 2 weeks following to optimize your healing. So for the surgical procedures themselves, after massive weight loss, again, either with surgery or on your own, it is going to be 3 to 5 surgeries if you want to treat your whole body. It's gonna be 24 hours plus of surgery. That's even at these big bariatric institutions. This fall I attended a meeting in Boston that was specifically just talked about the post-bariatric population, how much skin and some extra tissue that you still have that's just very difficult to lose. But these are very big procedures. And so when you're doing this, you wanna make sure you're not trying to have a person be under for more than 6 to 8 hours at a time. Over that, it's way too long. That's why a lot of times I have to divide surgeries up. Sometimes I can combine them. It really depends on how much excess skin that you have in each area that you want treated. I usually do divide up the areas. I usually start with upper body and then do lower body, depending on like kind of what you want to. Like this is part of your process. I want to do what you want your body to look like and be successful in that way. Some people have excess skin even in certain places that they don't care about. That's fine. We don't have to treat the whole body. It's really geared towards what you want to achieve. And then, yeah, plan to be out of work maybe like 1 to 2 weeks. If you had like an at-home job or a desk job, really with 1 week, the biggest pain is in a lot of my surgeries I put drains in because there's a lot of dead space that's left over that we remove the skin from. The drains are the pain. Usually after that, you can go back to work just fine. Okay. And then these are kind of the list of some of the surgeries that we offer our post-weight loss population, or just anyone in general. These are not just bariatric surgeries. This is for anyone who wants to do surgery to get rid of excess skin. We all have excess skin. I don't care how tiny you are, everyone has excess skin. So these are the surgeries I do offer here. A paniculectomy is essentially removal of the skin and soft tissue from the belly button below. Everything above is actually considered an abdominoplasty, and that is a different way we code things. A fleur-de-lis incision is one where some people after massive weight loss, they not only have vertical access, but they have horizontal access. Well, the fleur-de-lis encompasses both the transverse incision that you see in normal tummy tucks and a vertical incision to braid in your waist. So those are for people who have a lot of redundant skin after their weight loss journey. Brachioplasty is just an upper arm lift. The incision itself is usually from elbow to armpit. If you have a little extra skin on the side, I call it an extended brachioplasty. When you go all the way down to where kind of your bra line or below your chest wall sits. We also do upper body, or also known as back lifts, and removal of skin soft tissue from the back, as also thigh lifts. How I do my thigh lifts, and it really encompasses your whole thigh, is what's called a medial thigh lift, where you remove your incision basically sits on the medial portion of your thigh, so that if you're walking forward or behind you, no one can actually see the incision. And even though it's called a medial thigh lift, the whole thigh gets a lift. Other things I do as well is what's called mastopexy. It's also known as a breast lift. I'm letting you know already, most of the time breast lifts are not covered by insurance. Also breast reductions. I started that in the paniculectomy on the previous page because a lot of times I can get those covered by insurance. Again, every insurance company is different. Every insurance policy within insurance company is different. So I can never guarantee you're going to be covered, but we will always try. Also offer augmentation mastopexy. What that is after weight loss, or even after having babies, for those of us who have had kids, your breasts kind of can fall a little bit and you can lose some volume. For those women who wanna achieve volume and a lift, that's when I lift you and put an implant in at the same time. And then the lower body lift is, some people, I know Dr. Melton might, if you have him as a physician, he calls it around the world incision. So what it is a circumferential incision around the waist. So it not only gives you an abdominoplasty or paniculectomy, it gives you like a butt lift and a thigh lift and a back lift all at the same time, because I'm literally making an incision all the way around you. Next slide. And then insurance approvals. Unfortunately, as our bariatric population gets bigger, insurance companies are being very big sticklers about wanting to cover this. In the late 90s, early 2000s, it was a lot easier to get a lot of these insurances to cover post-weight loss surgery. It's very, very difficult now. It's almost as if the insurance companies are like, oh, this is like a hot thing and we're just not gonna cover people anymore. So unfortunately, what can help you get covered is seeing not just me, but seeing other physicians. Like, have your family physician be seen and document your post-weight loss journey. Have, a nurse practitioner, have somebody documenting your symptoms that you have, because with weight loss comes the rashes, comes the back pain, the neck pain, the headaches, yeast infections, bacterial infections from excess skin. Have someone else be documenting that other than me. That will help you get covered. And also when they're documenting too, I always have this shake. I usually say the same thing in all my notes, but have them also document that you're trying antifungal powders, you're trying absorptive potassium ointments, you're using compression garments, you're using multiple sports bras. All that really helps get you covered, because if you just say, oh, they're having this, well, the insurance comes in and like, well, what are they doing about it? So that's a big thing, is make sure that someone else is off you documenting that you would try and conserve management, but it has not relieved your symptoms.